Final day of Sport Integrity Week, powered by MasterCard. It is a very good afternoon to you. Of course, if you're in America, you're maybe just waking up as well, but it is noon GMT, 1 o'clock CET, and we've got a jam-packed afternoon for you to round things off of this 5-day event. If you have missed a panel, we'll have them up on our YouTube over the course of the coming days. Check our social media as well. And during the course of the afternoon, you'll see a QR code pop up as well in the bottom of my screen. If you want to sync your phone up to that, it takes you to an Eventbrite link. And in doing so, you can donate to help support SIGA, which is, of course, a non-profit organization. And in addition, you can participate in a poll where you get to vote on several different projects and programs that we're considering investing money into. And in doing so, you can vote on where your donation should be distributed towards as well. So effectively, you're helping shape our strategy. Do use the hashtag SIW as well to get involved on social media. Send us some fun pictures of where in the world you are watching the conference from, what you're looking forward to, what you've enjoyed across the course of the last 5 days as we start to wrap things up. We'll have a summary press release as well, incidentally, if you are on the media, and if there's any panelists that we can connect you to, do reach out to us via social media or email. So what's coming up this afternoon? Well, I'll introduce our next panel in just a moment, but 2 o'clock CET, that is 1 o'clock GMT. We've got Safeguarding Children in Sport, a personal, legal and psychological account. And then we continue the theme of safeguarding and talk about the clear and present danger of it to children and young people in sport. I'll be moderating that one. That to mark your card is 3 o'clock CET, 2 o'clock GMT. Then at 4 o'clock, Coaching the Coaches, the growing field of coach development. That one is moderated by Kristen Diefenbach, the president of the USCCE and director of the West Virginia University Center for Applied Coaching and Sports Sciences. And then we've got our evening session as well, and I'll give you a heads up on that a little bit later. But check out our social media if you'd like to see the full program. But right now we focus on holistic health, and this panel is titled Champions in Mind and Body. To tell you more, delighted to bring in our moderator, Graziella Thacker, the CEO of the Optimization Hub. Graziella, a very good afternoon. It is over to you.
Good afternoon. I'm going to have to go in and correct that name again. So Graziella, coming to you. It's a real pleasure to be back into SIGA Integrity Week, although I haven't left all week. I've been living in a different time zone. So I'm saying a warm hello as a Maltese Italian born in Mumbai, living currently in Queensland at the other side of the planet on a very cold winter's night in the Gold Coast. Can you believe it or not? I'm sitting here freezing in 13 degrees. That's cold for us over here. I've got a very auspicious panel today, and I've got to say, introducing a topic to you around holistic health. I mean, it sounds a bit like, gosh, are we talking holistic health and we talk about sport? But today's the theme has all been about youth and youth development and the safety of youth and youth development. And we've probably got to consider how much have we spent our time on looking at what the UN Secretary General has said to us. You know, when we look at António Guterres, he emphasised the necessity of reducing the impact of mental health in sport. And have we really done a good job? Because SIGA Integrity Week is holding us all accountable. We've got to become accountable. Are we doing what we're saying we're going to do? Or are we just ticking the box? You know, a healthy workforce in a better world. We talk about that. The pandemic is showing us we don't know how to do that. We certainly are completely losing it when it comes to things we can't control. Now, the world of sport, we've often had this misdemeanor, thinking that because we're getting out there and doing something physical, we're being healthy. But here's the challenge. The panel and the impact is going to deal with the impact of sport. We're going to be looking at mental health of athletes, the area that's been stigmatized and rejected. Often when we have an injury, we have this contention. We take care of our athletes. We're concerned for them. But mental health itself has been a stigma in our society, but it's no less than for our athletes, especially for our young athletes, who often avoid telling us if there is something that's impacting in their anxiety, their way of life, their living. And I've got a fantastic panel here today, so I'm not going to talk any longer. I'm going to introduce them and let them tell you something amazing about themselves. You're going to see this wonderful man dressed in blue over here. He's actually coming to us from the inside of a hospital in Malta. So Dr. Kirill Mikhailo Starfest, who I have got the pleasure of not only knowing as a friend and a colleague working with the Optimisation Hub, but huge admiration for what he's achieved as not only working with Maltese football, but the Maltese Olympic Association. Kirill, welcome. Tell us just a little bit about yourself before we move on to our other panellists.
Hi, Graziella. Take. Taking the Maltese. It's a Maltese, so I can get away with that. Basically, thank you for the invite. Very interested, very happy to be here. It's a very important topic and very relevant in these COVID times. Basically, I'm a sports and exercise medicine consultant and a senior lecturer in sports science based in Malta, working with the NOC, the National Olympic Committee, the Special Olympics also, and the Malta Football Association. And that's me in a nutshell, basically.
Wonderful. I'm going to extract even more from you as we go through this session, because I know our audience is going to benefit so much from your knowledge. And I know that at times you might get called away for some things you're doing for the government there. So we're going to appreciate if you have to jump between calls. I'm going to move on to Corinne Koreb. Now, Corinne, I don't know you as well, but I have listened to you this week. And I've got to say, I find you amazing. The context of your life, your history, what you champion, the fact that you've taken on so much. Your accent's going to obviously give you away from the USA, and we're going to get a little bit of a background look at not only you as a person, but what you're currently doing, both championing in SIGA, but championing is you've been in wheelchair tennis, you're a Paralympian, you do some incredible things with your life. Without me fumbling through that, could I ask you please to introduce yourself to the audience and the many things that you do?
Thank you so much, guys. I really appreciate it, and I really, really appreciate being on this panel. It is a subject matter that is of deep concern to me, especially with respect to people who identify as being disabled and who have chronic health conditions. I am currently in Clifton, New Jersey, right outside of Manhattan, New York. It's a beautiful day and it's super early. I work for an organization, Lakeshore Foundation, which is a Paralympic and Olympic training site. But what we do very specifically is focus on the empowerment of disabled people and those with chronic health conditions through different modalities, which is research, advocacy, policy, activity, and recreation. So this is a wonderful opportunity for us to all share where we're coming from on our respective platforms with respect to the overarching issue of mental health. So really appreciate this time with all of you.
Well, I know that you're going to have so much to contribute today, because I know all of the research, and every time I've given a keynote speech on athlete mental health, when I've talked about stigma, one of the things that's always come through that research has been how resilient our Paralympians have been and our Paralympic athletes have been. And I'm going to really enjoy hearing from you. And I know the audience is going to get so much from you today because of what you champion and how you work around that. Now, to our UK audience, I'm going to introduce somebody who you're all just going to go, oh, ooh. I get to work beside him all the time. His name is Ben Gollings, and he holds the World Rugby Sevens record still. He champions so much. He's absolutely humble for what he's achieved. He was your country's captain for a decade. Benny Gollings went on to not only overcome some of his own mental health challenges, but went on to be an athlete mental health trainer, working with onboarding and offboarding of athletes for us at the Optimisation Hub. He's dedicated to coach education. He's very much taken, a lot of interest and advocacy around the head injury space. Benny, please introduce yourself, because I might, again, miss some fantastic things out about you.
Graciela, and everybody, thank you. It's great. It is great to be on here. As a lot of people alluded to, it's obviously such a poignant topic, considering the climate we find ourselves in. I too am joining you from the Gold Coast. I'd actually say it's quite warm, but that's because I'm English. It's like a beautiful summer's evening here currently. But yeah, I think coming back to the topic, for myself, I was a professional athlete for quite some time, and enjoyed that time, and certainly experienced just how the mental side can be positive and negative and play on you. And so it's fantastic to be here to be able to support it and talk about it and share about it. And I'm sure I'll hopefully learn a few things as well whilst we're on call.
I think it's an absolute pleasure to have all of you here today. So for our audience, just introducing myself, my name is Graziella Thake. I'm currently the CEO of the Optimisation Hub. I've come out of the background of forensic psychology, where I worked in the maximum security jail and in a prison system for a decade. I was involved a little bit in the non-re-victimisation of victims in the child trafficking space for a wee sojourn of time. I spoke at the University of Peace in the States. I did a number of really interesting things around the planet. I also worked as change agent and in change management and in leadership and governance. I worked with 26 different multinationals developing teams. I have worked beside sport most of my life, although at 16 I got told to stop playing football. Both my girls, I have two wonderful girls, are playing and representing both nationally and for their state. And I'm also privileged to work beside an incredible group of people and a culture that we're very proud of at the Optimisation Hub that champions the development of sport through education and dealing specifically with mental health. I wrote the programs. I have, as I said, spoken all over the world. And one of the things that my early birth in India taught me through my father, who actually worked a little bit beside Mother Teresa, was that we might exist on one side of the street, but we're definitely responsible for the other side. He would take me into the slums and he would tell me, this is what you're responsible for. It doesn't matter where you live. So I think before we came on call tonight, we were having a really great conversation amidst ourselves, and especially with Karen, about how important it is for us to remember that privilege is something that we can't take for granted. Not all of us have equal access, and not all of us have an equal understanding of what mental health is. So I'm going to throw right out there to everybody the elephant in the room, and I'm just going to say to all of you, we're going to hit this where it hurts and start with, not just thinking about our careers, but we've got particular moments, obviously, that we've seen where mental health is impacting others around us or ourselves. And let's acknowledge that there is an elephant in the room. If we look at the theme of the week and we look at youth development and we look at integrity itself today, and we say, how good has sport been at tackling mental health? Let's just ask the simple question. Who'd like to jump in there and go first? Kirill, why not you? You've always got something to start with.
Well, I come from the medical base. Well, I can honestly say that sports psychology and mental health is lagging behind the traditional medical management of the sporting arena. And we're seeing it quite devastating effect right now because of COVID. It's having such a negative effect on our athletes at all levels. And, I come from a country, Malta, that had it quite good when it comes, we never had any restrictions as such. So most training could, at least on a personal level, keep on going. And we're seeing big issues with our athletes. And no, it hasn't been tackled well enough. Thanks to the bravery of a number of top athletes, the awareness has increased. And, toughen it up, okay, take it on the chin and keep on going. Attitude is slowly, I wouldn't say it's not there. It's slowly being removed and being replaced by awareness and the creation of a support service. I strongly believe that the only way we're going to ever win this psychological war is by education. And we don't educate the people from top to bottom, and especially people who are leading their sports. We're not going to ever see any real improvement, because if it seems to be up to less than a decade ago in some sports, and not most, it used to be a taboo subject. So to get from a taboo subject to something that's being discussed openly across the world, like we're doing now, is already a major step forward. But talk is cheap. It's in how we're going to practically, and logistically have it translated into actual actions in the field. And like someone pulls a hammy, they get treated. If someone is having sports-related anxiety or stress, how do we deal with that? Those are the toolkits we should be arming people with at this point. Why not discuss it and have it managed. The problem is there aren't enough people who know what to do with I have this problem in my country and all the places I've worked in across the world. It's always been an issue. You get a whole medical team, number of doctors, physios, masseurs, nutritionists, and then you get one psychologist for the whole team, including the academy, and a male and female. So it's always was always fighting a losing battle. But now with the awareness out there and people asking the questions, the hard questions, people addressing the elephant in the room, who might get from an elephant, will get down to a puppy one day and get it over and done with.
There's one way to eat an elephant, and that's small piece by small piece, isn't there? So we've got to really make a start, though. So that's a really good point. And I'm going to throw the floor over to Karen with that one and say, Karen, can you talk to us a little bit about, advantage and disadvantage, and whether you think, mental health has actually really been a part of the framework, having been involved in the Olympics from the perspective of both the Paralympics, but also thinking now, what you've experienced, what you've seen. Do you think we're any good at dealing with mental health?
Ooh, that's a layered question. However, thank you. First, I want to acknowledge that disability, while it's often the unspoken identifier, which represents approximately 1 billion people across the globe, that's 15% of our world's population who experience some form of disability. And we also know that disability prevalence is higher in developing countries. We're just beginning, like Krill said, we're just beginning to recognize that mental health is part of this overarching health conversation. And what we have always known in sport is that the mind, body, and connection is the basis for productivity. Like how well we train, podiums, winning, sponsorships, branding, and all of those things. Now, I know if my mind is cluttered, my output in my respective sport may be diminished depending if I'm aware or if I'm not aware of tools that I can have to mitigate that. Since COVID, what I would like to elevate, and I'm really proud of this specifically, is that the United States Olympic and Paralympic Committee was very progressive back in April when they created a multi-member Olympic and Paralympic task force with health professionals, their sports psychologists, to really address some of the overarching concerns that they knew would happen as a result of the pandemic. And we're very proud of that, especially for me as a person with a disability. I'm a wheelchair user for a long time, over 30 years, and a two-time Paralympian, is that there was a very active and transparent and authentic addressing of these issues. Now, we have 24/7 access to our telehealth. Again, when you're an athlete, what we know to also be true is that we live with an incredible amount of privilege. And thank you for sharing that earlier on. We have to stay on top of that. Are we addressing it as well as we could? No, because it is incredibly stigmatized to reach out for help, specifically in sport. And I think Ben talked about it earlier as well. It is a taboo subject. We're supposed to suck it up and hit the ball and get up at 4 and be fine with everything that's happening around us. But that is just not the reality of our lives. And disabled people, we're not a monolith. So each one of us is so incredibly different. And with different types of disabilities comes different types of concerns. And what I've recognized within high performance sport is that we have an incredible amount of representation with athletes who have disabilities in those spaces. So we are able to elevate the very specific concerns with respect to mental health and sport. And that's a really good thing. That's a positive thing. However, not everyone's an athlete. So we must recognize where those inequities are. And just like you said, when you're living in India, it's like we are our brother's keeper and our sister's keeper, and people who do not conform genderly, we have to look across the other side of the street. And what are we doing? What is our social responsibility in those spaces? So thank you for the question.
Fantastic. You know, there's more I'm going to come back at you with. So I'm going to take up that talking stick and hand it over to Ben and say, look, I looked at the world of sport many years ago, and the misdemeanor was, you know, I was seeing my friends achieving so much, and, you know, both Olympians and national representation, and having worked alongside rugby for a number of years, and just feeling like people have got that. And then, you know, as I started to investigate this, really take a look at it, you know, over the last decade, and especially over the last 5 years, and hear the stories. And really the misdemeanor is that when you transition out of sport, you've come out with a good 10, 20 years of this being ignored. And I know that Amelia Cook, who works with us, said, you know, you've got the person who deals with your physiology, you've got the beep tracker, you tell your time, you know when to eat, you know when to sleep, but nobody there is really dealing with how mentally focused you are and how agile you are, perhaps not even understanding what mental health is. Benny, what's your take on it? Has sport been kind or good to mental health, and what was your experience?
Well, I think as athletes, we can certainly pick up certain things that, you know, will benefit us and are strengthened through the sport that we do. But certainly, I would agree with the fact that athletes are also seen as that kind of bulletproof side. You've got to have that front about you. It's kind of how you would perceive to be handling pressurized situations. But ultimately, you know, inside that may not be the case. And, you know, for me in particular, we did have sports psychologists that worked with the team, but I think we were tackling a very different beast to what we're talking about here. You know, that was really focused on what my performance may be like on the field or what the team's performance was like. But it's also, we would start looking at it as a performance in life, and because those are the tools that you're going to use both in sport and outside of sport, and that's for everybody. And, you know, we're talking about youth athletes here as well as athletes who have, you know, gained many years of experience, and that's, I think, the important piece, that's going to broaden athletes and support, you know, young athletes having a better experience coming into sport and through sport, and then ultimately out of sport. For athletes who have already been in and haven't had that opportunity, it's definitely going to support them in terms of their ability to transition out of sport and see things for, you know, the way they should be seen, and in different environments, and understand the tools that they have picked up in sport, how they can be used in different ways in life. And I just think, you know, we have to support this topic strongly, because for many years it has been neglected. And I think it's great that there is an awareness now. And, you know, I think it's brilliant that obviously we live in a world where there's pretty much nothing that's unseen, right? Especially in terms of an athlete perspective, their lives are on show. Whereas before it wasn't the case. And, you know, people still think it's normal, but it's not. And they've got other lives they need to support. And that's where it can get confused. And in order to support the athletes, give them that awareness is great, but give them the tools that are actually going to better their lives full time.
You know, you raised some really important points, and I think one of the things is that sport, you know, I probably draw the question there, is sport a mirror of society, or is society, you know, and I also believe that sport is a great builder of society and community as well, if it's in a non-political sense. But one of the things I wanted to draw upon there is this bulletproof nature, the view, the judgment that athletes have got it all, and, you know, the regimes in place, you know, they're very much the gladiator look at the athlete. And perhaps we need to digress a little bit and say, you know, we possibly need to, define what mental health is, because I don't actually believe there's a great definition of that sitting out there. A lot of people, the misdemeanor is that mental health is mental illness. And so therefore talking about mental health is like, here's my stigma. I think I've got something if you're going to get me talking about mental health. Whereas, you know, I know in the Optimization Hub, we talk about mental agility, because it's about how agile is your mind, how prepared is your mind to be able to use the neurology of your body and access it clearly so that you can perform. And, you know, the tools that we learn in corporations, we don't learn in sport. And that is another misdemeanor as well. So, here you see this juxtaposition that corporations are investing in mental well-being and getting people to go out and be fit and to take care of themselves and take care of their health, of their body as well as their mind. You see in smaller nations like Malta, Kirill, and I'm going to draw this over to you, where the utilisation of sport for government has been, sport is being utilised as a way to retain health, physical health. And so mental health then obviously becomes a part of that, or does it?
Oh, yes, for sure. I mean, mental health is vital for every aspect of life, and if you don't have your little gray cells working optimally, whatever parameter you want to use, then obviously your performance, be it sporting or day-to-day living, is going to be affected. I mean, we've often discussed this, and what type of would, for example, a stressed athlete be more likely to be injured? And the answer is yes. Although in the past we used to think personalities would the type personality A, the tough guy or woman, are more likely to be injured because they go in gung-ho into training or whatever. The truth is, there's no predisposing personality, but external stressors do make a difference. A raised level of anxiety does predispose more to injuries. Some studies even have shown that stress can lead to increased muscle tension and increased awareness of preoccupation about the sporting activity itself. So that can lead to injuries as well. So rather than saying, yes, mental health affects performance, which we know it does, Ben was very right in highlighting that up to a few years ago, the role of the psychologists and mind coaches, and call them what you want, what's in the name at the end of the day, their role was to increase performance rather than for the mental welfare of the athlete and the support staff. Let's not forget in sports, very often the person most under stress is the coaching staff. So yes, we do see that mental health is vital. We see it not only from a performance perspective, but also from an injury and health care perspective. Stressed people tend to get more sick as well. So we're not talking only about getting injured, but also about the common cold and things like that. We do, immunity gets affected by many factors: lack of sleep, improper nutrition, altered appetites, other health issues, and mental health. And that's sometimes it's easier to sell the importance of the management of mental health to a sporting environment when you know that one can show to them this will affect the performance of the whole team. Not only from the physical performance when it comes to what they're doing in the pitch, on the ground, on the court, or wherever they're doing it, but also that the integral framework, integral fiber of an athlete is not only performance, but mental wellness. If they are underperforming from a mental point of view, they will underperform physically. They are intimately linked. There's no way to separate one from the other. Top athletes do have certain personality traits that get them there, but it doesn't mean they have been taught the coping mechanisms when they're not getting there, or they're not performing as they should, or they're performing as they should, but stresses around their sport is leading to other mental issues. So it doesn't mean just because you're top of the world, top of your sport, top of your best ever performance, you don't even need to be an elite athlete. You can be a fun runner who's just got his PB in the 10K or in another road in the marathon. You're at the top of your game physically maybe, but mentally you might not be. And because of the word Karen used was stigma, because of the stigma of mental health, people don't talk that much about these things, and they don't seek help. When very often all it takes is rather than help, it's just opening up to someone, and that's already the first step, because you're admitting that something isn't right. Finding the right, correct advice and the right people, that's harder. I mean, unfortunately, most of our sports psychologists and coaches have been trained to be that sporting performance-related psychologists. When it comes to other issues, anxiety, self-loathing, and things like that, they're not as well armed. So education starts on the matter is really far-reaching, from the athletes themselves at the lowest level and the youngest ages, and their support services, including parents, coaching, administrators, but also to the healthcare workers who work with them. Myself, I've been doing this job since 1993 now. So, no, I'm not that old. We graduated young as doctors in Malta. That's the way to get out of it. And I've seen a big shift in the way, in the mental friability of an athlete. Even now with social media, that's really, and you're always on TV and you're always on their scrutiny. The fact that they cannot chill out and relax anymore because they're immediately judged or immediately find themselves on social media, it's obviously creating a new obstacle course for our athletes at all levels. Because at the end of the day, everybody's got a smartphone nowadays. So whatever you do when you're goofing around, your teammates will easily take a video of you and plant it on social media. So we're talking about issues from top level to your teen and younger players. So,
really, that's a real, Kirill, I'm going to pick that one up, because I'm going to throw this out to Karen and also to Ben, because it might take that, and also because you've been an athlete as well. Here's a thought. When you think about it, sport is the only career that you're inducted into at 6, 7 or 8. And by the time you're 10, 12, 11, 16, you become professional. If we pick up on Kirill's point there, young people are coming into sport and, they are professionalizing. And then you have this induction phase and you come through, and we're not seeing the education in sport the way we need to. So what was it like for you, and what needed to be done differently? Because, sport is the only career in the world that we start so young. We professionalize young, and then suddenly we leave it with a whole range of things that we haven't been exposed to. Because remember that when you become dedicated in sport to something, and if you're any good at it, it becomes your 24/7. There's also another layer I want to talk to everyone about, and that's the layer that don't achieve world recognition or go on, but how sport is being utilised, and those who get to a certain stage, who might be in that churn and burn of sport. Because today's theme is youth development. So we pick up on what Kirill's saying there, which is so very important. Kirill, you and I have talked about this often, really often. Onboarding of sport, the onboarding of our young people. Karen, Ben, looking at your own histories in sport, what needs to be done differently to preserve the health and the mental health of our young people as they come into sport? Who'd like to jump in first?
Ben?
Ben, go for it.
Yeah, I think in regards to the onboarding, it's a really, really important area, because it really leads to the education, which is supporting the prevention of what may happen. So in order to give these young athletes and people who are applying their trade in sport the tools that are going to support them and educate them in the different circumstances they come up against in a pressurized situation, or you're not getting on so well with, that could be affecting you don't realize, or a coach that you're misreading and trying to question as opposed to not question how you communicate properly with them. And then that may come on to management, and are you hiding injury rather than talking to people about it? All the different things educated at a young age you can actually nurture and mature with through sport and through the time that you're in sport, as opposed to learning on the fly when it suddenly happens or not, and then getting to the end of your career and all of a sudden it's like jumping off the edge of a cliff because you just won't. So I think, you know, for me personally, having been through the journey I've been through, you know, I learned a lot of the good lessons when I was younger, but certainly there was some fundamental things I missed along the way. And I think you talk about being able to control the controllables. Well, personally, on the field, I was in the zone and I could control that. And that was something I could control well. Probably off the field with certain things I can control well. And if I look back now and I had some of the tools that I've learned about and utilized more now, and understand and have better knowledge on, I definitely think I've made, I can regret those decisions, but it would have supported probably a healthier lifestyle through rugby and through the career I had, but also on the outside. So for me, when we're looking at the young people nowadays, I think as a whole, sport has a fantastic opportunity to nurture and grow a really healthy population, and used as an example of what we can do to support young athletes, this whole mental health, mental agility space, and show what we can do within the sporting space.
I know that's something that you explained a lot about when you came into the sports curriculum that we have at the Optimization Hub. And there's that conversation that often gets had, if we had these tools when we were. So, you know, that's something, you know, we'd like to work really hard to prevent, you know, to make sure that young people have the tools early on. Karen, what was your history like? What do you think needs to be done differently for young people?
Again, my background, you know, I come from a German culture, and within our culture, very specifically, there is a level of expectation of perfectionism and just onward and forthing, and just this high level of ableism. I think what's incredibly important, and I think SIGA has done an excellent job by creating the youth group. One of the things I feel is incredibly important is asking our kids, asking our youth, what is it that you need? Because we as adults tend to think, or guardians and caregivers, or whoever that person is in a coaching capacity or in a mentorship capacity, we think we have all the answers, but do we ask the right questions? In my background, I mean, very often you were guilted and shamed into performance. Therefore, it creates this codependence relationship. And so that creates never-ending desire to be better than what you are. We need to encourage not only ourselves, but our youth specifically to be okay with what is. One of the things that this entire epidemic, this pandemic has taught us, or I would like to think it's teaching us, is, you know, we are restricted from going out. So you must be alone with yourself. Who are you without your stuff? Who are you without your team? Who are you without your sport? Who are you without your education? Who are you without your big car, or however you have defined yourself? So this introspection is really incredibly important. So one of the things that we're doing at Lakeshore Foundation, aside from creating the youth group, is we have an entire series of mindfulness. So, and I'm fortunate to be able to lead that. And I'm super grateful, because giving and teaching the tools of how to be very present, working on breath work, working on the basic tenets of mindfulness-based stress reduction, acknowledging that there is stress in sport, and not even in sport, but in life. We must elevate that these are actual things, and they're valid, and they deserve their rightful space in each person's life to be addressed the way they want them to be addressed, not the way we want them to be.
Really, really important point about asking the question. I remember when, in founding the Optimization Hub, we held a number of focus groups, cross sections, to make sure that we were asking people, what do you need, what's missing? And understand that, it's only in listening to what people are willing to tell you is wrong that you figure out what they need and where you've got to plug things in. Kirill raised a really important point that you've both carried forward, which is the context of our mental functioning is such a valid and important part of life. And yet mental health has been a stigma because it's been misunderstood as, disease or disorder, whereas mental health means just that, to be mentally healthy. I think if we take it and unpack that a little bit further from what Kirill spoke about before, is that there is an antecedent that anxiety will be a precursor to being more vulnerable when it comes to disease, when it comes to injury. There are studies in France and also in Canada around, injury and sport, especially through Canada. I know in France, and talking to Matt Plenty about, even the COVID situation, he said, look, Graziella, that, here what we're seeing is that people are more susceptible to COVID because they're anxious and depressed, or they're feeling isolated and alone. And so that draws upon your point, Karen, and that is that the social context that we're in, for some of us, and again, this draws into the privilege and the opportunity, for some of us, being alone is really difficult and threatening because not only do we draw our context of identity from social grouping, so we've seen that with athlete groups we've worked with, especially the young groups, who started off okay at the beginning of COVID. And this is where we draw our attention to COVID as a situation. We now have in this pandemic, this social isolation is being thrown at us all the time. For some of us, we are good at introspection. For others of us, it is like a jail cell. We don't want to go there because we need that social context to provide us with what reinforces our identity. Athletes are very much people pleasers, and they're shaped that way by the systems that surround them. So, from a very young age, you're taught one way of being. And as we've all heard, we've heard from all of you, that way of being and the context of sport itself and the way that we learn sport, the way we form those relationships with coaches and with our audience and our environment, now through social media, we have that continued pressure around, to be liked, I must behave like this. So the context of sport itself, to make it healthy, to now encourage us to say, okay, so how are we going to be inclusive? How are we going to ensure that the integrity of health is preserved for all of those in sport? We examine the pandemic and we say to ourselves, okay, in the pandemic, things are certainly going fairly pear-shaped. And, it's pointing a finger at, we weren't doing this very well in the first place. So mental health wasn't really being taken care of. That's why it's really falling off the cliff at the moment. So, we were doing a lot of things badly. Now they're even more vulnerable for us. So, in this context of the pandemic and in what we're currently seeing, what must we change? What must we use as an opportunity to say, neurologically, you have a brain and it functions like this and it connects to your body, and you need to learn how to use that as much as you need to learn how to use your muscles. Just like we're doing with corporations, we need to do this in sport. How are we going to improve? What are we going to suggest to those listening in our audience they need to pick up and do to improve the context of health and sport? Kirill.
Well, first of all, it's an very interesting take on excuse the pun, on the issue. I think first thing that people have to appreciate is that the brain has to be trained. We don't train the brain like we do the rest of the body. It's going to underperform. Now, underperform does not mean underperform from a physical point of view only, that you will have inferior sporting capabilities, but you will underperform when it comes to life in general. And you will be less equipped to be able to deal with the stresses, such as COVID and this pandemic, because let's be honest, it's a stress not only for sports people, it's a stress for everybody. Anybody has been affected by this pandemic. I personally have been affected from a medical perspective. I've been affected from a sporting perspective. I'm being affected by the fact that I had to spend all my holidays in Malta rather than going around the world like I usually do. So, we've all been affected, be it psychologically, financially, emotionally, whatever way you want to look at it. Now, for an athlete, I think, and we've seen it with our top athletes. Our top athletes took this as an opportunity. And that's why they're the top athletes. They look this, okay, the Olympics have been delayed, the World Championships have been delayed, they've been cancelled, whatever. This gives me the opportunity to work on the weaker parts of my technique in, for example, weightlifting. Or I've been having these niggling issues, niggling pains, and I have to deal with them. So let's focus on them. Those are the top athletes, and they know how to focus. They're the ones that need help in various areas psychologically, but not that much from other areas. Then you have the general public, and the general public who are athletes as well, who regularly train. How we're going to address them? I think it's the same thing like with everybody. I don't really believe that we have to really reinvent the wheel. It's just that we have to package the psychological tools such that we have to deal with the stress that pandemic is giving us. It's not reinventing, it's just readdressing.
We had a question in from the audience we need to finish up on, because we're just on that point of go here at the moment. There's a question from one of the people in the audience saying that they get approached from nearly as many mental and mind performance advisors and coaches as they do with financial advisors, and they work with their clients. How do they sort out the pretenders from the pros, as there doesn't seem to be a marking? There doesn't seem to be a criteria. Everybody thinks they're great at mental health now. So this was asked by Jonathan Broker, from Sporting Director of Sports Turin Sports and Media. I got to say, I kind of agree with that one. It's one of my irritation factors. I tell them to check out the Optimization Hub site. But what do you guys think as we close up today and say thank you to SIGA? What is going to help us sort out the people who know what they're talking about from the pretenders?
Okay, let me go there. I go and get it over now. Well, basically, I'm a strong believer in accreditation and registration. I believe, like in many professions, you can't practice being a lawyer without having a warrant, or a doctor without your warrant. Same thing with the mental coaches, trainers, and call them what you want, depending on the sector or country. They have to be accredited. And that's the only way forward. And you, as an athlete, you can check up and see if they're accredited and registered. And if they're not, then they're probably a weekend mental coach, not rather than a professional one.
So they have to have done some training. Danny, what do you reckon?
Yeah, I agree. I think people can use a lot of experiences to relate to, but it should be backed up with the education piece. And I agree with Kirill that there should be a mark there that states that you have been through some form of training that supports the fact that you are accredited to deliver in that space. And we're talking about integrity, and I think that just holds that integral badge completely, and that's what people should be looking for.
Awesome. Karen?
Yes, well, I agree with Ben and Krillian. I also want to throw out that, we live in a very vast informational place right now. I would encourage all people to do their diligence. Those of us who have access, do the research. I don't do anything without doing an incredible amount of research, not just about the credentials that someone may hold, but what is it that I'm actually looking for? And so to empower people to do their own research, to find their solutions and see what actually will work for them.
Karim, that's an excellent point to leave off on. I think you raised it first. Ask the question, go out and ask people, make sure that you find out from people who've experienced something, or go do the research. If you can't do the research, your gut's usually pretty good, but make sure, as Kirill has said to us, that we look for accreditation. Ben has raised the issue of education, and myself, Graziella Thake, I'm going to say to you that it's really important for us to take this on as something we must deal with. We must transcend end in sport. To wrap up on today, we've got to say a really, really big thank you to SIGA to making us take a look at the integrity of these issues and to forcing us through this week to not only look at what we're not doing, but to come up with assessments of what we can do better and putting it into action. Thank you, SIGA.